My name is Emily, and I'm the mother of an 8-year-old who has been a patient of Dr. McWhorter for a couple of months. My daughter Gigi is 8, and she had a really rough start. She was in the NICU for 3 months and had respiratory distress, and it looked really bleak. So from very early on, we were in early intervention, and we've been trying to figure out how to help her basically for 8 years. At age 3, we got the diagnosis of global developmental delay and autism. And we've been really hardcore into a lot of different therapies, doctors, interventions, anything we've come across, we've basically tried with my daughter. Dr. McWhorter is the most recent thing we've tried, and I can tell you that we've gotten much more progress with Dr. McWhorter in the few short months we've been here than we did with a lot of the other things that we've done. My daughter Gigi, when she was born, had low tone, hypotonia, and has struggled with gross motor function, gross motor development. She didn't learn to jump until she was 6. She's been very clumsy, had problems with proprioception and vestibular awareness. Everything sort of, as far as ambulating or motor function, has been a real challenge, and that's what brought us to Dr. McWhorter, because that's his specialty. The gyrostim chair is something that I had come across in previous research, but there were no providers in Southern California. So when we got connected to Dr. McWhorter and realized that he was specialized in this and that he had this chair, we were really excited to start with him. That's been one of the primary focuses with our work with Dr. McWhorter here is really helping my daughter's vestibular and proprioceptive and gross motor issues. And we've seen phenomenal change in the few months that we've been here, so much so that my daughter, who couldn't jump until she was 5, is now jumping up on a slack line with no problem. And we're getting a lot of really good feedback from her school that she's able to participate in like the sharks and minnow game or the chase game with her peers that she wasn't able to do before. So I would say one of the biggest areas of improvement that we've seen with my daughter since being here has been the motor function, and the vestibular and the proprioceptive systems have really improved, and we've only been here for a few months. So if someone were to ask me that had a child in a similar position to our family, if they thought Dr. McWhorter was a good fit, I would say absolutely. One of the things about Dr. McWhorter that you don't necessarily find in a lot of different practitioners is his willingness to sort of personalize the treatment plan, and he does a really good evaluation, and he's very confident, and he's got a lot of experience, and using that experience and that competence, he's able to really put together a package that's going to deliver results. So I would definitely recommend, a family that has a similar situation to ours to come, even if it's a lot of effort. We drive over an hour 3 times a week each way to come here, and we haven't even had to think twice about that because it's been so impactful for our family. So that's a no-brainer for us.